Welcome to our channel. Today we're diving into the findings from the CAT trial, which compared the effectiveness of Ranibizumab and Bevacizumab in treating choroidal neovascularization from age-related macular degeneration, or AMD. This groundbreaking study has provided valuable insights into how these two treatments stack up against each other, and we're here to break it all down for you. In patients with AMD, both Ranibizumab and Bevacizumab resulted in similar improvements in visual acuity at 1 year, regardless of whether they were administered monthly or as needed. This finding is crucial as it suggests that both drugs are effective in managing the condition, offering flexibility in treatment schedules based on patient needs and preferences. The Marina study in 2006 showed that monthly injections of Ranibizumab improved visual acuity in wet AMD. Meanwhile, Bevacizumab, a low-cost alternative, was being used off-label. The CAT trial aimed to determine if Bevacizumab was non-inferior to Ranibizumab and whether an as-needed dosing schedule was as effective as monthly injections. This comparison was essential to understand if a more affordable option could provide similar benefits. The CAT trial was a multi-center, single-blind, randomized controlled trial. It enrolled 1,185 patients with newly diagnosed, untreated AMD. Patients were randomized to receive either monthly Ranibizumab, monthly Bevacizumab, as-needed Ranibizumab, or as-needed Bevacizumab. Ophthalmologists were masked to the medication, but not the dosing schedule. This rigorous design ensured that the results were reliable and could be confidently applied in clinical practice. At 1 year, all 4 groups showed similar improvements in visual acuity. However, patients receiving Bevacizumab had more serious adverse events than those receiving Ranibizumab. Monthly administration resulted in more gains in visual acuity compared to as-needed dosing. These findings highlight the importance of considering both efficacy and safety when choosing a treatment plan. The cost difference between the medications was significant. Ranibizumab cost approximately $23,000 per year for monthly dosing and $13,800 for as-needed dosing. In contrast, Bevacizumab cost $595 per year for monthly dosing and $385 for as-needed dosing. This stark contrast in cost makes Bevacizumab an attractive option, especially in healthcare systems with limited resources. Similar findings were reported in the IVAN trial, which also compared these two medications. A pooled analysis of CAT and IVAN data found no significant difference in visual acuity between the two drugs, but suggested a benefit of continuous dosing over as-needed dosing. This reinforces the idea that consistent treatment may yield better outcomes. The American Academy of Ophthalmology recommends anti-VEGF therapies, including aflibercept, Bevacizumab, and Ranibizumab, as first-line treatments for neovascular AMD. It is important to counsel patients on the off-label nature of Bevacizumab and obtain informed consent. This ensures that patients are fully aware of their treatment options and any associated risks. In summary, Ranibizumab and Bevacizumab are similarly effective in improving visual acuity in wet AMD. However, Bevacizumab offers a more cost-effective alternative, despite a higher rate of serious adverse events. The choice of treatment should be guided by patient-specific factors and careful consideration of risks and costs. Ultimately, the goal is to provide the best possible care tailored to each individual.